A very good evening to everybody. Welcome to another very interesting episode of The Different News. Today, I have my gorgeous guest right from Dubai, Dr. Alejandra Guerrero Barragan. Dr. Alejandra is a neuroscientist, a public health specialist, as well as a hypnotherapist. Today we have very interesting things to talk about because nowadays we hear a lot about the cognitive disorders, the common ones like we all know dementia, Parkinson's, and so many other things. Well, I welcome Alejandra to my podcast and thank you so much for being here today. And it's a pleasure to host you and talk to you.
Thank you so much, Dr. Gargi, for inviting me, for having me here in your podcast. I'm very honored to be here and I'm ready to have a conversation.
Yeah, I think you have a very interesting career, Alejandra. Of course, you have your medical degree, your medical specialties in the neuroscience field. But what it triggered my interest is more like you are a certified hypnotherapist and there is something called as the RTT technique. I'm not a specialist, but I think a lot of things to ask you. But my favorite question would be to understand your entire journey, where you started and how you got interested in the field of neurology and what exactly are you doing at present?
The journey has been long. Since before entering medical school, I was fascinated about the brain. I remember even when I was a kid, I was like, oh, the mind, how do we speak? How do we do all the things? How do we move? So for me, that was fascinating. And I entered to study medicine to be a neurologist, to be a brain doctor. Finished medical school. And the first thing that I managed to do was getting into the residency of neurology. So this is, apart from the medical school, it's other 4 years of specialization only in neurology, in the brain. My specialty is clinical neurology. So we treat all the diseases that are not for surgery. Epilepsy, headaches, dementia, Parkinson's disease, everything on all that it's related with the brain. Yeah. And during this training, I started having a special interest on cognition, everything related with cognition, because the brain at the end is what makes us who we are. Absolutely. Without the brain, we don't have identity.
True.
And I always been fascinated by this kind of diseases like Alzheimer's or other types of dementia, when we really see that when the brain stops working properly or has these pathological changes and some different areas of the brain are affected, we can see the change that this makes in the person. So it's sad. Those are sad diseases because we can see how the person loses the identity. We see this in frontotemporal dementia, for example, which is a dementia that affects behavior. So this is amazing because someone that, for example, during their whole life was very, introvert, was very calm, suddenly with this disease can get extrovert, hypersexual behaviors that are not correct only because the frontal lobe is not working properly.
Okay.
So, and this is fascinating. I was like, oh my gosh, I need to understand more and more about this. So during the residency, I went abroad. I'm from Colombia.
Okay.
And I went to Barcelona and spent some time in the memory unit in Barcelona, some months. So I had a special training in these cognitive disorders in the memory unit in Barcelona. And at this moment, I was sure that this was going to be my whole career, no, but very focused on the clinical part. Having people with problems, and then I'm in my clinic, I would make a diagnosis, and that's it. I started and I graduated from neurology, and I started practicing, and I saw that I was doing what I wanted, seeing patients and giving them a diagnosis, and that was nothing else, because there's no support for this kind of conditions. And this is a problem that it's not only, for example, in Colombia. This is dementia. It's a global pandemic. Actually, before COVID came, dementia and Alzheimer's disease was called the pandemic for the 21st century.
True.
The COVID came and it changed a little bit the landscape, but again, we are going to see that dementia is going to be more prevalent in the coming years all around the world, and the numbers are very scary. So I saw that there was this gap in everything, from the awareness of the people, identifying symptoms at the beginning of the disease, and then all the path that someone has to go through to have a diagnosis, and then treatment and support. And with all these gaps, I was very lucky. I applied to a fellowship that was focused on dementia and cognitive disorders, and I won a position in this fellowship. It's called the Atlantic Fellows for Equity in Brain Health.
Wow, amazing.
And thank you. And this is an international organization, part of the Atlantic Institute, which is a philanthropic organization. I went to Ireland and had training in brain health for 2 years. And the most amazing thing happened there, because when I won the fellowship, I thought I was going to go for clinical training, to be like super expert in this clinical field. And when I went there, the other fellows were not doctors. They had journalists, they had artists, they had people from the community, and I was like, what? What is this? How come? Like, as clinicians, usually, and this is part of the ego, I think, of being a doctor. You think you are the only one that has the knowledge and knows how to manage a disease, and think about it, and you're the only one that has the solution and everything. And when I saw all these people working in dementia and in brain health from different perspectives, I was like, oh my gosh, this is so big that the hospital and the clinic is not enough, for sure. And working one-on-one with patients, of course, it's very important. And I have colleagues that are very happy to do that. But for me, I was like, this is a gap. This is a gap in my life. I need to do something bigger.
Correct.
So that's why I decided to go into public health. And in public health, their focus, it's about prevention of disease and promotion of health.
Absolutely.
How can we improve our health systems, our health literacy, awareness of the different conditions, so we can catch the populations earlier before they get sick? And all the things that can be done at the societal level, at the community level, not only at the individual level. And also in public health, we study how the other factors like social factors, economic factors, environmental factors also affect health.
Correct.
And these are things that you as a person sometimes cannot change, but it's important that you be aware that this has some influence in your health. No?
True.
So I got this huge now, like my view was like more open about the specifically dementia, because this is my area of interest and cognition. So I published and I did some research locally in Colombia about the social determinants of dementia, of cognition, and we were able to show how, for example, income inequalities can increase the risk of dementia.
Right.
Having less access to education increases the risk of dementia. All these things that are inequal in our societies, how they affect the risk of someone for having dementia. And also, of course, this included with the individual and the personal risks. So the topic is giant, and we can speak days, I think, about it, and we will never end. So I started to changing my focus and the focus of my career to prevention, because I've already seen that when patients are sick or when people are sick, it's too late.
Correct.
Nowadays, there are options, or there are things that we can do, but the earlier we start preventing and taking care of our brains, of our health, the better outcomes we are going to have. Then, because of life, because I like to change and I like to do new things all the time, we decided with my husband to move to Dubai.
Okay.
To practice as a clinician initially. So I came back to the clinic job as a neurologist, general neurology. I've been here in Dubai for 2 years now.
Okay.
And something that I saw, I will say since day one, I don't know if you're aware, but the community of Dubai, it's mostly young people.
Yes, absolutely.
Or people in the with a working capacity. So these will be people between 25 to 55 years old. This is like the biggest number of the population. So I was ready to see patients with dementia, for example, and there were no many old people here. And I was like, what am I going to do? But that as soon as I started working, people were coming to the neurology clinic having memory problems, attention problems, cognitive problems at 40 years old, at 45, 35, 30. I was like, what is this? Why? There's no clinic explanation for these people, this much people, having these complaints.
Right.
So studying more and more and more, I came up to the conclusion that it's stress what is causing this. Stress and anxiety. And I will say stress and anxiety are the most prevalent mental health conditions in our modern societies. This is not only in Dubai, this is all around the world. People with burnout, people working long hours, because this is how society works. Have to work 8-9 hours a day, and then there's no time for nothing else. There's no time for exercise. There's no time for going with the family. There's no time to enjoy life.
Right.
They were coming to me and I was asking, and I was saying that at the end, all these complaints were related to lifestyle and mental health issues. And I was like, I need something to help. How can I help? And then that's why how hypnotherapy came into my life.
Amazing.
And because I was like, now I need a tool a tool for me to help people to change these behaviors.
Right.
And reading and like reviewing different tools, I think hypnotherapy, it's a great tool. It's a technique that tries to go to the subconscious mind and tries to reprogram your brain to behave better. But I found this technique that it's called RTT, which it's Rapid Transformational Therapy, which is not only hypnotherapy, it also includes neuro-linguistic programming and some meditation, mindfulness, like it's a mix.
Okay.
And it was designed by Marisa Peer. She's a very famous therapist. She's the therapist of the famous people in Hollywood.
Oh.
Yeah, and working with her and going through the course and to the training was amazing to see that this actually really works. That we have so many beliefs that we have inside our minds, and usually these beliefs are starting when we are children. And they stay there and they mark how we behave when we are adults.
Absolutely.
And the thing is that we behave like kids, but we are adults.
Right.
So we need to train again our brain and tell our brain and our mind to behave like an adult and not like a kid.
Correct.
That all these beliefs, behaviors, they were born maybe because of something that happened at that moment, but that something that happened doesn't define who we are right now.
Yeah.
And that we can always change. And the brain can always change because it has this powerful characteristic that it's called neuroplasticity.
Absolutely.
And neuroplasticity is the ability of the brain to build new connections.
Correct.
With hypnotherapy, it's faster to build these new connections of the brain.
Yeah. I just got engorged about what you were speaking because psychology pulls me a lot. So from childhood, I have read a lot and I read a lot right now as well. You 2-3 words that I picked up while you were speaking is one is our belief system and then the subconscious mind. I think in general, who are not from the field, like I also belong to a lay public in this matter. So we are actually not taught how to understand beyond our conscious mind. So as you are an expert in this field, how can somebody, look into their belief system, which they have built from childhood, as a different person altogether? As you said that I really know about neuroplasticity, and I also studied a very basic level of neuro-linguistic programming just out of my interest. So I have learned a lot of interesting facts like which you are telling in depth right now. So this question actually haunts my mind. By the time we get matured, by the time we are actually facing the problem, we don't know where exactly the root is. So is there some way that we can visit our belief system as a separate individual so that we can identify and probably, as you are saying, that take up preventive measures with help from experts like you? So that is one question. Would you like to answer that?
So the first thing, it's awareness, no? Because you need to be aware that you are behaving in a way that maybe let's talk about health, because in this field, it's our lives, no? So it's not only health, it's the way we have our relations, the way we deal with the world, the way we work. So let's focus on health, because this is a very big topic. So if you have any health behavior that it's a bad behavior, let's say smoking. So the first thing is to be aware that smoking is not good.
Correct.
But what we see is that even people knowing and seeing the boxes, all the bad stuff that the smoking causes, people choose to keep smoking, no? Yeah. Despite this. And this is because there is something that is causing this behavior. And this behavior, it's because there's a belief in behind, no, behind the scenes.
Yeah,
the program it's running there. And in the case of smoking, this is an addiction. It's trying to fill a void. It's trying to give you pleasure from something that you didn't have.
Right.
And then at this moment, when you have the awareness, then you need to take an action. And there are different ways to take action. That some people say that we all need therapy. Some kind of therapy, we all need it. Because these behaviors, these beliefs are automatic patterns that are running in the back, behind the scenes. So it's not easy to say and to discover and to say, okay, I'm smoking because I'm trying to fill the void of not being loved in my childhood or of not being enough. It's very difficult. And that's why there is a therapy, or there are therapists that can help. So it's not only hypnosis, for example, talk therapy, psychiatry, psychologists, professional people, and people that are experts in going to the roots.
Correct.
Of kind of things, and can help us understand why do we behave in the way we are behaving. And when you are aware, then the next step is taking action.
Correct. So basically, if we want to modify our existing belief system, like as you said, just trying to summarize what you said, is actually facing the problem and understanding and being aware about our small habits, maybe something that we want to change. So and then taking the right professional help and getting into some solutions. So I think it's a very, very important suggestion or advice that you gave right at this point. So Alejandra, coming to typical neurological or cognitive disorders that it's so much global now, everywhere it is there. So stress, anxiety, burnout, and I'm surprised that the statistics that you gave, that people of so young age are coming and you are diagnosing them with such things, which is really alarming at this point. So what do you think is the main trigger for this kind of diseases being so rapidly spreading in the entire population? I'm not talking about a regional population, but as a whole human population. So what do you think are the triggers for this? Why it is becoming so much spreading out nowadays?
I think it's modern life, because all the way the world is working and the dynamics that we have in the world are against health. The diet that we have, it's a pro-inflammatory diet. lots of sugar, lots of
Correct.
processed food, lots of chemicals, uh, all the time industry and these big companies are bombarding you with nice options and that eating chocolate is fine, that having a diet coke is fine, it's very much have this thing. So all these things, all our diet is pro-inflammatory. That's one thing. The other thing is this the phones. Phones are a good tool. They were a great tool, but I think right now it's one of the main causes of all the attentional problems that we have for since childhood through middle age to late life. Everyone is attached to these machines.
Correct.
All the time. And even I'm guilty myself. All the time I'm having this by my side, and consciously I've seen that even if I'm not doing anything, I will take my phone and I will start scrolling mindless like a zombie. And
Like a zombie. True.
because before, and these things are cutting social connection, are
Correct.
cutting our creativity, are cutting everything, our intelligence. And actually there are some studies. I'm not very familiar with that research, but I've read some information about it, that our IQ is going to decrease because of these things. And if you think about it, it's real. Before, when people were sitting in a waiting room with someone, what they will do? They will start speaking about the weather, about the waiting time, something.
Correct.
We'll start a conversation, and so sometimes you can make friends only talking. Now, when you're in a waiting room or even in an elevator, everyone is like this, avoiding the other person.
Absolutely.
When you when you have some time, what do you do? Going to Instagram, going to TikTok to watch these stupid videos. Before, what were people doing? They were writing.
Yes.
They were journaling. They were doing manual craftings. They were having creativity. Now, nothing. Nothing. If you see the babies, for example, in a restaurant, babies, they put the phones for the babies, the screens, and the parents are either doing the same with their phones or not paying attention to the babies.
True.
I've seen, for example, the nannies. The nanny, it's with the baby going in the carriage, and the nanny is texting, and the baby is looking like, hey, nanny. So this is starting from the zero.
Yes.
This is another thing, diet, phones. And the other, it's the pressure that we have in our works.
Correct.
Because works are very demanding all the time. They are putting pressure on the person. The market is, I don't know, saturated or something like this. So, and you know, companies, they don't have soul. So everyone is afraid of losing their jobs.
Yeah.
So people overwork, over-deliver, and they get stress, anxiety, lack of sleep. The lack of causes more anxiety. So at the end, it's a cycle, like a snowball, one thing in top of the other. The anxiety and the stress leads them to the phone, and this makes us, because I have to include myself there, this makes us less creative, less social, less everything, no? Yeah. And at the end, all this is causing with the job, we don't have time to do exercise, which is another thing, because for 8 hours, you need to be sitting on an office, calling, doing the job, and the sitting hours they are taking years of life from us. So this is promoting sedentarism, lack of physical activity, and this is another risk factor. So if you see, it's a snowball, and at the end, everything is related with the modern lifestyle.
Correct. That's a very practical things that we actually keep seeing around us, but we are not ready to accept all these things, because at least nowadays, I think one best part of reels, I would say that many people talk about these things nowadays, so we learn things, we get aware about all these things. But as you rightly said, that just awareness will not help. We need to take some action. We want to, if we want to really change, we need to do something about it. So I think it's a very interesting conversation. I think, I don't know, we can go hours and hours long. Yeah. Alejandra, one thing I just wanted to understand. So, for example, certain common, this is a common man question when it comes to, neurological disorders or cognitive disorders. So, for example, we talked about dementia. We also hear about Parkinson's, or say something Alzheimer's. Like, say, if I take these three kind of pillars, so are these related? Because kind of things when we see clinically, it is quite late, as you say, whether for dementia or for Parkinson's. Are there any early symptoms which, as an individual, or say maybe the family members, could become more aware of, and they might become more alert, so that they can understand these cues, what the body or the person is giving, and learn those cues, and probably then take the more preventive action before the disease progresses to a certain extent. So can you help us with some information on this?
Okay, so first let's clarify one thing. When we talk about dementia, we talk about an umbrella term that has many diseases inside or under the umbrella. And the most common one is Alzheimer's disease.
Mm-hmm.
This is part of the cognitive disorders.
Okay.
And these disorders are the ones that will affect memory, will affect attention, will affect the behavior, language, or visual-spatial abilities. And there's another group of neurodegenerative diseases that it's called motor disorders or movement disorders.
Okay.
And in the movement disorders, Parkinson's is number one. So we have dementia, cognitive disorders, Parkinson's, movement disorders. But for example, Parkinson's disease can be related with dementia. And some patients, 30% of the patients with Parkinson's disease at later stages, they can develop dementia. Oh. And then they will go under the umbrella of dementia. And they can have dementia due to Parkinson's disease. So let's talk first about dementia in general.
Sure.
Dementia, when we talk about dementia in general, we are talking about Alzheimer's disease, which is cause number one, and vascular dementia, which is cause number two. This is related with vascular damage from the blood vessels. We know in the, I will say like in the last 10 years, research around the risk factors have been super strong. And we know now, thanks to this research, that the dementia is somehow preventable. Before, let's say 30 years ago, people will say, no, this is part of aging. This is what was called senile dementia, which was dementia because you are old. And That's it. So if you are old, you will have dementia.
So
Sorry. Yeah. Yes. Sorry, there's nothing to do about bad luck.
Yeah.
But now, for example, this term of senile dementia or age-related dementia doesn't exist. That's not a thing. This is something that it's in the past, because being old doesn't mean having dementia or having body problems.
Okay.
So nowadays we know that 45% of the cases of dementia could be prevented if we address these risk factors.
Oh.
And we have to address these risk factors through the life course, because as we were talking before, addressing them when you have symptoms, it's it's too late. It's too late. So we have to start since childhood. For example, in childhood, the most important thing is education. Having the chance to go to school, to finish school, this will protect you against dementia. Then we have the next window, which is midlife. So when we talk about midlife in this area, it's until 60 years old.
Correct.
And this moment is where we can address all these risk factors of hypertension, obesity, smoking, physical inactivity, having high cholesterol levels, alcohol consumption, brain trauma. And in late life, it's very important the social connection or avoiding isolation. And also the quality of the air for all people, for everyone it's important, but if you can address that at old age, it will also decrease the risk of dementia. So that's why awareness of these risk factors, it's super important, and that's the message you've seen that I always give in my posts and in my social media, that we have to address this early, as soon as possible, today.
Correct.
And we have to be aware that all these things can cause dementia, but if we address them, they can prevent dementia. And it's not only dementia, it's also overall health. Because if you are physically active, if you are managing your blood pressure, if you are managing your cholesterol, if you are managing all these risk factors, you are also protecting your heart, you are protecting your kidneys, you are protecting your muscles. So your late life, it's going to be good, it's going to be healthy, you are going to be able to enjoy.
Yeah.
And even if you get the disease, the way you are going to live with the disease, it's different, because your body will be strong, your brain will be strong. So many people that have these healthy lifestyles can live with dementia, and they can live longer, and we can see that these conditions are degenerative. So we see that with the time, the person can get worse. But many people, they can be in the same baseline for years, because they were preparing their brains and their bodies just in case. They're having a stronger, healthy bodies. The signs. So you asked me about the signs. All of this to tell about the signs. So the signs are, when we see the signs, this is in late life. When we see the signs, the pathology and the changes of the brain are already there. And this is a fact. There's a famous curve where this is described. So first, you will see the changes inside the brain with what we call biomarkers. Nowadays, there is access to these biomarkers. So 10 years before having any symptom, you can have this blood test, or you have a lumbar puncture. You can check the levels of these proteins, and you can see if you're at risk of developing this disease 10 years before. Then 5 years before, there are advanced image techniques that you can do to see if these proteins are inside your brain. And still, you won't have symptoms.
All right.
And then we will have the clinical symptoms. So when the clinical symptoms are there, the process, it's already been done, and this is a 20-year-old process.
Correct.
That's why it's so difficult to treat it at this point. And with Alzheimer's, the most common one will be memory problems. These memory problems are usually for short-term memory, things that happen recently. Because the hippocampus is the first area of the brain that it's affected or damaged by these toxic proteins that have been building up their presence in the brain.
Yeah.
So we see memory problems that are consistently present during time, and they get worse over time, and they are not normal. So forgetting where do we leave the keys is not, it's nothing to worry about, because this is something that usually happens because you don't pay attention. But forgetting to pay a bill, or forgetting your son's birthday or your wife's birthday, things that are important and that the person previously wasn't having these problems, this is the red flag. These changes that at the beginning can be very subtle, but with time they will be there. So what we always tell the families, and what all people above 60 years old have to be mindful of, is how is my memory at the moment? Am I remembering everything? Can I learn new things? No, I'm feeling that I'm having some kind of problem. I'm feeling that I'm not myself. So that's the time to go to the doctor, to seek for help. There are screening tools that we can use in the clinics that GPs, nurses, neurologists, psychiatrists can use to see how is the cognitive process of the person, and if there is any risk of having the disease. And then we can start the diagnosis process and then establishing the treatment plan. But memory is number one symptom, but there can be other symptoms. For example, change in behavior. This is something that it's very usual that we see. Suddenly the person gets depression or gets anxiety without any reason. Problems with language, not being able to recall names.
Recall the particular words, yeah.
Yeah, having a conversation and forgetting the word, but not like the everyday forgetting the word, because we all can have that.
Yeah.
But these things become, like more frequent over time, or are things that before for sure were not happening. For example, if I forget a word now, the most probable thing that will happen is that after some time, I would remember. I would say like, oh, the word I wanted to say is this one. Then there's no problem. But in this case, we see that there's a block. The person is not able to remember what was the word, what was the idea. This is also a red flag. And even this is still an area of debate. If we should screen all the people above 65 years old for cognitive disorders, because we know it's so prevalent that at 65, out of 9 persons, 1 will have dementia, which is a lot.
Yeah, that's very alarming. That's a very alarming number that you were saying. I mean, the ratio that you were saying, yeah.
And as we are aging, the number gets shorter. So every 1 in 5, every 3, every 2. After 90s, it's every 1 out of 2, 50%.
Oh my God.
So age is a risk factor. And at the moment, we cannot do anything about aging because we will age.
Of course.
But all the other risk factors are there. And if we can try to prevent this 45%, why not doing it?
Absolutely. So thank you. I mean, thank you, Alhandra. It's very interesting things that the things that you are telling. It's so unknown. We don't know much about it. You told that lifestyle modification, like we all talk about it. So, like doing exercises, having good food, I mean, the correct food. So, you said that one interesting line that caught my mind is that dementia could be reversed. I mean, it is if it is like if we identify it early and we do some preventive strategies, do lifestyle modifications, it could also be reversed. So, um, can you tell us about certain kind of foods probably which we should include in our diet, which might help in the long run to get rid of such kind of cognitive disorders, because that's the most easiest thing a human being can do. I mean it's just your body, your own mind. It's not even any other people. So I think it will be a very valuable information. And just taking 1 second from you, I would request to all my viewers who are watching this, please follow Dr. Alejandra on LinkedIn, because the post that she does is amazing, because you will learn a lot of things which we, I won't say that we are not aware at all, but the consequences, how it is related to our brain health and the overall health, that's amazing. So, yeah, so coming back, so Alejandra, can you please tell us about some, food which actually might be very good for brain health, and what would be, how do we include in their diet? Maybe I know it's a very based question that I'm asking, but maybe some tips if you can give.
Yeah, sure. I also have a YouTube channel. It's in Spanish, but it has subtitles in English. So all
Yeah,
these topics that we are talking about here are also available on YouTube.
amazing.
Um,
What's the name of your channel?
the name it's my name, so it's Doctor That Alejandra
Oh,
Neuro.
sure. Okay. Thank you for sharing.
Thank you. So first, I think I need to clarify one thing. Reversion, we are not sure yet that we can revert Alzheimer's with the lifestyle.
Okay.
But for example, last year, we know that we can control and that we can stabilize the symptoms. But last year it was published the first randomized clinical trial showing actually that lifestyle can reverse dementia.
Amazing.
And this is a protocol from a lifestyle research group in the States that they are using all these strategies, and they are showing that reversion it's possible, and there's some kind of evidence, but still we are not 100% sure, but there is evidence. I don't like to talk about diet. I prefer the word pattern, eating patterns. Okay. Because when people hear diets, they get scared, no? We get scared because I think we all have tried diets.
One
and not successfully.
We have tried, and we have, we have left it very nicely as well.
Yes.
At least I have done it.
Yeah, me too. So we know that diet, when we say diet, it sounds like something strict that you need to do, and that you need to follow. And if you don't follow, you're doing bad. The focus of many dietitians before, this is changing now, but the focus of many dietitians before was don't eat this, and this, very restrictive.
Yes.
Don't eat any bread, don't eat any sugar, don't eat anything. At the end, you will be able only to eat apples and spinach.
And very bitter, bad tasted smoothies. I don't know what hell. Yeah,
And we know that this is not sustainable in
not
time.
sustainable, not at all.
Not sustainable because there are some foods that we know are bad, but they are good. They taste good. What to do?
What to do?
Yeah, it's the reality.
Yes.
So if we talk it like patterns, this means that almost every day you will eat following the pattern, but someday you can have what they call the cheat day.
Yes.
So that day you can have a hamburger, you can have an ice cream, and nothing will happen.
Mm.
Your brain will be fine because the rest of the days, the rest of your diet, it's in the healthy pattern.
Right.
So the pattern that it's recommended for brain health, it's based on the Mediterranean diet,
Yeah.
on the Mediterranean way of eating. So this includes a lot of leafy greens,
Okay.
vegetables, green vegetables. This includes spinach, kale, peas, all the green leaves. Everything green, it's good for the brain. Berries, because berries they have antioxidant properties. And the number one berry for the brain is the blueberry. Blueberry. So eating one portion of blueberry daily has shown decrease all the inflammation in the brain.
Wow.
And this is proven. Healthy fat. And the healthiest fat is the one that is coming from nature. Number one, avocado. And also nuts.
Yeah.
Walnuts. If you've seen a walnut, the shape is like a brain.
Brain, yes, absolutely. It's like a brain.
So, nature is wise and is showing us that if this looks like a brain, you should eat it for the brain.
Very true. Very true. Yeah.
So avocados and walnuts as source of fat. Animal protein, the idea is to reduce the consumption of red meat and increase the consumption of meat that has healthy fat. And this is the number one, it's fish.
Yeah.
And in fish, we have fatty fish, which the number one, it's the salmon. There's another one called mackerel. I haven't tried that one, but it's also in the list of
If you come
fatty
to
fish.
India and in Bengal, it's fish all around, and it's very good. So variety and so much of variety, and I think
so
amazing.
You have to give me a longer list of fatty fish that we can find.
That I think.
Trying to prioritize this type of fish, it will give omega-3, and omega-3 it's super good for the brain. Eggs. The eggs, they have choline, and choline, it's an amino acid that it's very good for the neurons. It increases the communication of the neurons. And there are these spices spices that we can use. Turmeric, it's very good for the brain.
Okay.
Saffron, it's also very good for the brain. And I think it's turmeric and saffron.
Okay.
And fiber, it's also important to consume. Fiber, it's more focused on gut health. But if our gut is healthy, our brain is healthy. Because, there's this axis that it's called the gut-brain axis. So having a healthy bacteria microbiome in the gut will also help the brain. And the number one thing for gut health is probiotics and fiber. Lots of fiber.
Mhm.
And we can get the fiber from whole grains, whole rice, whole pasta, that all whole bread. So all the things that we should eat, they need to be whole.
Okay.
So if you're a pasta lover, a rice lover, okay, you can have it, but make it whole.
Mhm.
And the, at the beginning, the texture it's different, but at the end, it's the same.
Same. It's the same.
It's
True.
yeah, and it's small changes that you will do, and you will see the change in your health. For example, talking about these whole grains, the glycemic index, so the way they spike the glucose, is less than the other grains. So this is also helping for diabetes, helping for other conditions.
Yeah.
Like it's amazing, and it's just reading. Being aware and mindful about the decisions that you are making every day. What are you putting in your plate?
Absolutely. I think it's a fantastic conversation. And I think, as I said, we can go on and on. But I think I need to call you for another episode where we really talk about subconscious, conscious mind, conflicts of mind. I think that's a fantastic area as well. So, thank you, Alejandra, for this amazing tips that you have given. And I think through this episode, many people will get a bunch of knowledge together, golden nuggets, I must say, because these are very important things that actually makes our life easier. And as you said that, I mean, that is something which is really hitting my mind when you said that young age people are getting all these disorders. So I think it's time that we really need to be little alert. So before you go, I just want to ask you that if you have any message for people out there, please share your message.
So my message is that it's never too early, never too late to start taking care of your brain. And if you want to have your best brain and your best brain health, it starts with your daily choices and the way you are living your life. And if there is something wrong, you can always change at any age. First awareness, then action, and action is always possible.
Thank you, Alejandra. Thank you so much for sharing all the great piece of great advice and the knowledge that you have from your extensive career as a clinician, as a hypnotherapist. I don't know how much you have studied. And yeah, I think you are a lifelong learner. That is what gives me the impression of. And thank you so much for being here. It was wonderful talking to you.
Thank you for having me, for inviting me. It was also wonderful, my pleasure at any time.
Thank you. Thank you, everybody, for watching this episode. And please subscribe my channel and to see more such fascinating episodes related to science and technology. Thank you.